Hello everyone, welcome to sqadia.com, and now we will start our section 2 of the lecture topic menstrual cycle and hormonal disorder. In this we will talk about the phases of menstruation in the ovary, and just a quick review. We talked already about the physiology of the menstrual cycle in our section 1, in which we talked about the hormones of the menstruation and the organs involved in the menstrual cycle. So, phases of menstruation in the ovary. In this, we will talk about three main phases which are taking place in the ovary. First is the follicular phase of menstrual cycle. Then we will talk about the ovulation, and then the third we will talk about the luteal phase of the menstrual cycle. All these three steps takes place in the ovary of the female reproductive system. So in the follicular phase starts on the first day of the cycle. So right after the menstrual bleeding starts or cycle starts, we enter into the follicular phase of the menstrual cycle. So starting from the first day of the cycle. In this phase, FSH and LH from the anterior pituitary gland travels to the ovaries. Like I mentioned before, FSH stands for follicle stimulating hormone. So you can see, as the name tells, follicle stimulating hormone, this hormone really plays very important role in the growth of the follicles in the ovary. And this follicle stimulating hormone stimulates about 15 to 20 eggs or follicles in the ovary. Out of these 15 to 20, only one follicles mature and reach to the final stage, and that once rupture release the egg or ova. So every cycle there are 15 to 20 follicles which develop, but out of all those 15 to 20, only one reaches the maturity. So in the follicular phase, FSH stimulate the growth of the follicles in the ovary, 15 to 20 follicles in the ovary. And this follicle then stimulate the production of the estrogen hormone. Once this stimulates the production of estrogen hormone, as we talked about this in the previous section also, that in most of the cycle, once the estrogen is produced, it has negative effect. So it decreases the production of follicle stimulating hormone, because follicle stimulating hormone already performed its function, which is the growth of the follicle, and once it grows, it starts producing estrogen, that in turn decreases the production of follicle stimulating hormone. So only one follicle mature, and that follicle now continues to produce estrogen. So in the follicular phase of the menstrual cycle, mainly FSH produced by the anterior pituitary stimulates the production of follicles, about 15 to 20 follicles, and out of those follicles only one mature and produce estrogen. Next phase now is the ovulation and the luteal phase. Ovulation is the time when the ova or the egg is released from the ovaries. This is roughly in a cycle which is 28-day cycle. This occurs on the 14th day of the cycle. So most fertile time in the female is the time of ovulation. Females who are not using any contraceptives, or if they really want to conceive or become pregnant, this is the most fertile time where the ova is produced. And this lasts for about 2 to 3 days. The ova survive around 48 hours. So this is the most fertile time in the females who have regular menstrual cycle. Females who have irregular menstrual cycle, this is not very reliable because irregular cycles, the ovulation time is not very predictable. But with regular time, 28-day cycle, ovulation mostly takes place on the 14th day of the cycle with the release of ova. So ovulation is the time with the release of the ova that follicle ruptures and release the ova. Now, LH triggers the luteinizing hormone. It breaks the follicle and releases the egg on the 14th day of the cycle. Now, at this time, when the fertilization doesn't take place and the egg that is released, it goes and it is embedded in the endometrium. And this now LH here, what happens is it converts the follicle to the corpus luteum. Its corpus luteum is a yellow structure. It performs the hormonal function temporarily. What happens is now this temporarily produces the progesterone, and this progesterone brings secretory changes in the endometrium of the uterus. Brings both estrogen and progesterone now bring changes in the endometrium. So here, this is a very clear in this graph. If you see what's happening here is we have in the first follicular phase, there is increase in FSH, which causes the follicles to grow, and then we have decreased level of in the middle here. This is the LH. Here, see, this is the LH, luteinizing hormone surge, which causes the ovulation here. And then after this, both these hormones decrease, and then there is increase more in the progesterone and little bit lower level of the estrogen. So in the first phase, more estrogen. At the time of ovulation, more luteinizing hormone, and then after in the second phase, progesterone is the main hormone that's so here proliferative and then the secretory phase of the endometrium. Proliferation when the tissues are growing, and secretory when the glands are increasing in the uterus. So here ovulation takes place. So if we roughly summarize our phases that's occurring in the ovary, we have three phases of cycle in the ovaries. We have proliferative phase, we have ovulation phase, then we have luteal phase. In the follicular phase, follicles grow and one of them mature and release ova under the influence of hormone, follicle stimulating hormone. Then once the ova is released, then if it is not fertilized by the sperm, menstruation takes place or shedding of the endometrium takes place. In the first half, estrogen level is high. In the second half, progesterone level is high, and in the middle, it's mostly the luteinizing hormone that causes the rupture of the follicle and release the ovum. So this was all about the phases of menstruation in the ovary, which are follicular phase, ovulation, and the luteal phase. So this concludes our section 2 of menstrual cycle and hormonal disorders. Thank you for watching sqadia.com.